Let me ask you a question that most men think about, but rarely say out loud. What actually happens if you ejaculate every single day? Is it healthy? Is it harmful? Could it boost your performance? Or secretly drain your energy over time? If you've ever wondered about this, you're not alone. I hear this question constantly in my clinic, from men of all ages, all backgrounds, all walks of life. It's one of those topics that exists in the shadows, half whispers, myths, bro science, and sometimes guilt. And yet, it sits right at the center of men's health, relationships, and confidence. Today, we're pulling it out of the shadows and putting it on the table. I'm Dr. Thomas, a board-certified urologist with over 12 years of clinical experience helping men take control of their sexual and overall health. I've sat across from thousands of men, young professionals, fathers, athletes, executives, all asking variations of the same question. And in this video, I'm going to give you the full picture. No shame, no guesswork, just straight answers. We're going to break down the 5 surprising benefits of ejaculating daily, the 5 real drawbacks you need to watch for, and, most importantly, how to figure out what's actually right for your body, your goals, and your life. By the end of this, you'll walk away informed, confident, and clear. That's my promise. But first, drop a comment and tell me where you're watching from today. I love seeing this community grow across the world. And while you're down there, hit that like button and subscribe. Every week I cover the men's health topics that most people are too uncomfortable to touch. Now let's get into it. Let me clear up the biggest misconception right away, because this matters before everything else. There is no universal answer. Ejaculating every day is not automatically good for you, and it's not automatically bad. It depends entirely on why you're doing it, how you're doing it, and what effect it's having on your body, your mind, and your life. Some men feel sharper, calmer, and more focused with a daily release. Better sleep, less cortisol, more drive. Others find that it quietly dulls their desire, drains their stamina, or even creates performance problems they can't explain. The truth lives in the nuance, your biology, your habits, your life stage. Here's something I want you to hear clearly. If you felt confused about this, that's not a personal failure. Most men were never taught how their bodies actually work when it comes to sexual health. Nobody sits them down and explains the endocrinology, the neuroscience, the clinical evidence. They just pick up myths from the locker room or the internet and carry those myths into adulthood. That's why, after over a decade as a urologist, I made it my mission to cut through the noise, to translate complex science into practical, no-nonsense guidance that men can actually use. So think of this as a conversation between doctor and patient, one where I'm going to be straight with you, because straight talk is exactly what you deserve. Benefit number 1, pleasure hormones and mood regulation. Ever notice how grounded you feel after ejaculating? That sense of calm, that reset, that's not imagination, that's neurochemistry. When you ejaculate, your brain triggers a coordinated release of powerful chemicals. Endorphins, your body's natural analgesic. Dopamine, the reward signal that drives motivation and confidence. Oxytocin, the bonding hormone linked to trust and emotional connection. Serotonin, the mood stabilizer that keeps you even-keeled through the day. Biologically, this hormonal cascade resets your nervous system from a state of tension to a state of equilibrium. Emotionally, it reduces anxiety, lifts your mood, and helps you feel more anchored in yourself. Practically, that means less snapping at your partner, less bottled frustration, more patience and resilience in daily life. For men dealing with the pressure of work, relationships, and responsibility, a daily release can act like a physiological pressure valve, a consistent, natural reset, not a cure-all, not a replacement for real mental health care, but a genuine, biologically grounded tool. Benefit number 2, better sleep quality. Here is something my patients often don't connect. Sexual release and sleep quality are directly linked. After ejaculation, your brain releases prolactin, a hormone that induces deep relaxation and signals your body that it's time to wind down. Stack that on top of the endorphins and oxytocin flooding your system, and you've got a built-in sleep protocol. For men who lie awake with racing thoughts, performance anxiety, or work stress, this matters. Biologically, it's about hormonal signaling. Practically, it can mean falling asleep faster, staying asleep longer, and waking up with better recovery and sharper focus. Sleep is when your testosterone consolidates, when your muscles repair, when your brain processes information. Anything that protects sleep quality is protecting your overall performance as a man. Benefit number 3. Improved blood flow and circulation. Orgasm isn't just a brain event. It's a full-body cardiovascular workout, brief but real. During arousal and climax, your blood vessels dilate, your heart rate elevates, and circulation increases throughout your entire body. This vasodilation delivers oxygen and nutrients to your muscles, your organs, your skin, and your brain. It keeps your vascular system responsive and adaptable. Biologically, it's like putting your cardiovascular system through a functional drill. For men over 40, this becomes increasingly important. Keeping endothelial tissue flexible and reactive is a cornerstone of long-term erection quality and heart health. Practically, it also means your erections tend to be stronger and more reliable when you maintain regular sexual activity. Use it or lose it isn't just a gym principle. It applies here too. Benefit number 4. Lower risk of prostate cancer. This is one of the most compelling findings in men's sexual health research, and I want to make sure every man hears it. A landmark Harvard study tracked over 30,000 men for nearly 20 years and found that men who ejaculated 21 or more times per month had a significantly lower risk of developing prostate cancer compared to men who ejaculated far less frequently. The leading theory is that ejaculation helps flush the prostate, removing old cellular material, inflammatory agents, and chemical buildups that can, over time, contribute to malignant changes. Biologically, it's a natural cleansing mechanism. Emotionally, it should give men reassurance about one of their most common and most feared health concerns. Practically, this doesn't replace prostate screenings or clinical checkups. Those are non-negotiable. But it does mean that sexual health and prostate health are not separate conversations. They belong in the same conversation. Benefit number 5. Immune system support. Here is one most men don't expect. Regular sexual activity and orgasm can actually support your immune defenses. Studies have shown that orgasm increases circulating levels of immunoglobulin A, IgA, one of your body's first-line antibodies against bacterial and viral threats. Add to that the cortisol-lowering effects of regular ejaculation, and you get meaningful, if modest, immune support as a side effect of sexual health. Biologically, that's a stronger defense system. Practically, it's one more reason to integrate sexual wellness into your broader approach to health, not as an indulgence, but as a legitimate physiological investment. Now, in the interest of giving you the complete picture, because that's the only kind of picture worth giving, we need to talk about the drawbacks. Because daily ejaculation, like any habit, can work against you if it's done mindlessly or compulsively. Here are the 5 biggest risks. Drawback number 1. Compulsive behavior. There is a critical distinction between a deliberate, healthy habit and a behavioral compulsion, and men need to understand this clearly. If you're choosing daily ejaculation consciously for pleasure, stress relief, or intimacy with a partner, that's a legitimate, healthy behavior. But if you feel driven by an urge you can't control, if it's eating into your productivity, your relationships, your focus, that's a different situation entirely. Biologically, compulsive sexual behavior can alter the reward circuitry in your brain, diminishing your sensitivity to normal pleasure and requiring escalation to achieve the same effect. Emotionally, it creates cycles of guilt, shame, and secrecy. Practically, it can quietly erode the very confidence and presence it once seemed to provide. The question every man should ask himself honestly, am I choosing this, or is it choosing me? Drawback number 2. Using it as an emotional crutch. Men face enormous pressure. In the workplace, in relationships, in their internal lives. Stress, loneliness, boredom, and sadness are real. But if ejaculation becomes your primary, or only, coping mechanism, something important is being missed. Biologically, it creates a single pathway dependency for emotional relief. Emotionally, it can prevent you from developing the skills and connections you actually need. Practically, it substitutes for the real work, exercise, honest conversation, journaling, therapy, brotherhood, purpose. Sexual release should be one tool in your toolkit. When it becomes the only tool, the whole structure gets fragile. Drawback number 3. Lower sperm count. If trying to conceive, this drawback is specifically relevant for men who are actively trying to father children. Daily ejaculation reduces sperm concentration in seminal fluid. Biologically, Sperm production requires a replenishment window of approximately 48 to 72 hours. Ejaculating daily doesn't allow that cycle to complete. Emotionally, this can add frustration to couples already navigating fertility stress. Practically, spacing ejaculations every 2 to 3 days during conception efforts is a clinically sound strategy that can meaningfully improve the odds. This isn't about abstinence. It's about timing and intention. Drawback number 4. Reduced sensitivity or desire. Here's a paradox that shows up in my practice more often than men expect. Too much frequency can actually blunt the very desire it once satisfied. When ejaculation becomes highly routine, especially if it's hurried or mechanical, your dopamine system adapts. The signal weakens. What once felt urgent and exciting begins to feel flat. Biologically, this is desensitization. Emotionally, it can manifest as reduced interest in your partner, lower spontaneous arousal, or a vague sense of disconnection. The fix is often simple. Take a deliberate break of a few days. That reset, brief as it is frequently enough to restore sharpness and reignite desire. Sometimes the most powerful thing you can do is pause. Drawback number 5. Performance issues if rushed. If your daily ejaculation consistently happens through fast, hurried stimulation, your body learns that rhythm. Your nervous system encodes it. And over time, that conditioning can carry into partnered sex in the form of premature ejaculation or performance anxiety. Biologically, your autonomic nervous system has been trained for speed. Emotionally, this creates frustration and embarrassment for both you and your partner. Practically, it undermines confidence at exactly the moments it matters most. The correction requires deliberate reprogramming. Slow down. Practice edging, bringing yourself to the edge of arousal and then backing off before release. Incorporate breath control. Train your nervous system for rhythm, control, and presence, not just speed and relief. You're not wiring for urgency. You're wiring for mastery. So what's the bottom line? Daily ejaculation is not inherently healthy or harmful. It is a behavior, and like all behaviors, the impact depends entirely on how you engage with it and why. Ask yourself these 3 questions with honesty. Why am I doing this? Is it pleasure, intimacy, stress relief, or is it compulsion or avoidance? How is it affecting me? Am I sleeping better, feeling more confident, more energized, or am I noticing fatigue, emotional flatness, or reduced desire? Does it fit my goals? If conception is on the table, is my frequency working with or against that? Here are practical steps you can take today. Pay close attention to your body. Track energy, mood, and libido across different frequencies. Don't just assume, observe, experiment with intention. Try daily. Try spacing out every 2 or 3 days. Notice what actually serves your body and your life. Build sexual wellness as part of a broader health toolkit, alongside quality sleep, consistent exercise, strong nutrition, and meaningful relationships. And if you're with a partner, communicate openly. Your sexual health is connected to your relationship. Never dismiss physical changes, new pain, reduced erection quality, changes in prostate function. Those warrant a clinical evaluation. Full stop. One more thing, and I mean this directly. If this topic has ever triggered shame, confusion, or anxiety in you, you are not weak for that. Sexual health is human health. Asking these questions doesn't make you broken. It makes you honest. And honesty about your body is where real strength begins. Here's what I know after 12 years in this field. Men who understand their bodies make better decisions. They have more confidence. They have stronger relationships. They carry less hidden shame and more genuine authority in their own lives. You have the power to adjust. Whether it means adding a deliberate pause, slowing down your practice, using intimacy as real connection rather than escape, small calibrations create major results over time. Your vitality is not fixed. Whether you're 30, 50, or 70, your body can adapt, your health can improve, and your confidence can grow, but only if you give it the right inputs. Keep learning, keep listening to your body, keep building the kind of life that earns you real energy, real clarity, and real strength. I'm Dr. Thomas. Thank you for being here. If this video gave you value, give it a like. Subscribe for straight men's health content every week and drop your thoughts in the comments. I read every one. Remember this, your body is worth understanding. Your health is worth protecting, and your vitality is absolutely worth fighting for. Take care of yourself, men. You've earned it.